I'm Linda Miller. I'm the speech therapist here at Southminster, and I'm going to do some training for the Relias training program on augmentative communication. So I want to start by just telling you a little bit about what augmentative communication is. And that's basically anything that we use to help our residents communicate better. It can be things they want, things they need, or preferences related to their ADLs. Who needs augmentative communication? Anybody who can't communicate on their own. It can be people who have dementia, and that cognitive process allows them the need for us giving them some way to communicate better. It could be someone has had a stroke and they can't speak, or they don't have the language in order to communicate what they want or need. So there's a lot of different reasons, but the bottom line is if somebody cannot communicate what they want or need, we need some way to sort of help them do that. The first way that I'm going to show you is with a dry erase board. This is probably one of the easiest ways to facilitate somebody being able to tell you what they want or need. And primarily we use it to write down choices for questions that we're asking, and then letting the resident point to the choice that they are making. So for instance, if somebody wants something to drink, and by asking them, what would you like to drink, they can't tell you, then we need to give them some choices that they can choose from. So we might say, would you like milk, Coke, or tea? And you ask them to show you which one they want. You want to tell them out loud the choices and point to them as you're presenting them so that they know what you're asking them. And there's no need to write the question down on the board. We're just asking the question and then pointing to their choices. Sometimes you can give them the pen and they can circle it, or they can point to it, whatever works for that individual person. And I will say that with each person that we use augmentative communication with, I will most likely, or the speech therapist that's working with them, will sort of let you know what technique works for that individual person. So you say, hi, Mrs. Smith, would you like milk, Coke, or tea? Show me which one you would like. And she might point to tea, and you say, okay, great, I'll get you some tea. So you can use those written choices for anything related to their ADLs. It could be anything they need. Do you need to go to the bathroom? Do you want to lay down? Are you in pain? You can ask them preferences for food. If you're looking at the menu, would you like chicken or grilled cheese? It can be, who would you like to call? Your daughter, your son. So anything that is in context of what situation that person is in, you can come up with different choices for them to answer. I would probably keep it from 2 to 3 different choices. That's probably the simplest form. You can also use the dry erase board just for yes and no questions. If somebody's not able to verbalize yes or no, or if I ever let you know this person says yes, but it's not always accurate, that might need a written response for them to answer correctly. So you would just ask them the question, do you need to go to the bathroom? Yes or no? Can you show me? And then they can point to yes or no. You always want to give them time to respond. Sometimes they'll point to one and then go to the other. It's always okay to ask them the question again, to repeat it, and just tell them, I just want to make sure I have the right answer. I'm going to ask you again, do you need to go to the bathroom? Yes or no? Show me which one. So the way that you'll know if somebody is supposed to be communicated with using the dry erase boards, a couple different ways. It will be on their AOD on the computer system. Once I establish that as the most appropriate way to communicate with somebody, I'll let nursing know and it will be put on the AOD. if you see a dry erase board in their room, then you can assume that that is definitely the way that you should be communicating with them. Also, if you notice anybody having trouble communicating, when you ask them a question, they have a difficult time verbally answering you, or you don't feel like the right thing is coming out, or they can't answer yes and no, or they say yes all the time to every question, definitely let nursing know, or one of the therapy department members know, and I can definitely follow up with that and see if there's anything that we can do to establish the augmentative communication for that individual resident. All right, so this is an example of using the dry erase board to ask a yes or no question when, you know, it's difficult for someone to respond with a yes, no. So all you do is you write the yes and no responses down on the board, ask the question, and then ask the resident to circle the correct answer. So Sally, do you want some sweet tea for lunch? No. So she said, no, I wouldn't like any sweet tea. Okay. Hold on one second. All right, the next way you can use the dry erase board is to ask for choices when you give different options. For example, sweet tea, water, or Dr. Pepper to ask what you'd like to drink. And Sass wants sweet tea. So she's very familiar with using this method to tell me what she wants, and you just present the question and give the options. I do like to also add, which I didn't at first, but add other just in case the three choices isn't something they want, and she would circle other, and then you kind of go back to the drawing board and add different options. Okay?